Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, along with my producer Lindsay today, and today we have the privilege of having Dr. Susan Ashley on the line from Family Practice in Liberty Lake, and she is going to be talking about a specific treatment that she uses called NAD, and she can get into some of the science of that. It's a abbreviation for a big long word, and how it can treat different addictions: alcohol addiction, methamphetamine addiction, opioid addiction, and some other things too. So you will, I think, learn a lot in this episode, and learn how some traditional methods of treating addictions have not worked, and how Dr. Ashley has some great success stories with what she's been doing. So, Dr. Ashley, welcome to our show.
Thank you. Appreciate it.
Yeah. So tell us a little bit about your history, and what got you into this NAD, and then we'll talk a little bit about the specifics of it.
Sure. Well, I'm board certified in family medicine. Been practicing family practice for about 20 years when I started taking an interest in anti-aging and regenerative medicine. So I received a board certification in that as well, and that's where you really learn the good stuff, the fun stuff about how to slow down the
Absolutely.
aging
Yep.
process. So many different treatments that aren't available in the traditional medical world, including things like bioidentical hormones and that kind of thing. So, and about 2 years ago, I attended a conference, and they were discussing this product called NAD that I'd never heard of. And what they were describing seemed too miraculous for me to be truthful. I knew I needed
Right.
to learn more. Um, and so I did. I went to the New Orleans area and received my training there, and have been using it on a variety of patients, mainly for substance abuse. But it works like nothing else I've ever seen.
So tell us some specifics about NAD, what it is, and some of the science behind it, without getting too geeky about it. But tell us some why it works and how it works.
So NAD stands for nicotinamide adenine dinucleotide.
Wow, that's a big word. Let's say that fast.
But it's a fancy word for it's actually a cofactor of vitamin B3. Um, so it's a vitamin therapy, and it's been around since the 1950s when it was first found to treat alcoholism. And so since then, it has been perfected, and many different protocols to treat all kinds of substance abuse. And it's interesting, in the 70s, Alcoholics Anonymous, AA, used to recommend NAD for all their clients because they found it to be so successful in taking away the cravings for alcohol. But
Wow.
then they found so it was actually on their brochures and everything. And then with new leadership, they took the recommendation away because they found that people that completed a course of NAD then weren't attending AA meetings anymore because they were essentially cured and did not feel the need to have to attend. And so their membership went down, and so they quit recommending it. But
Wow.
the way it works is you have to give it IV because you want a high concentration, and you want to drive it through the blood-brain barrier and get it into the brain where it can work. And it helps to correct the areas in the brain that have been damaged by years of substance abuse, including the receptors of your neurotransmitters like dopamine. And so it corrects those areas. And when it, after about, well, a typical course is 10 days, and it eliminates the cravings for drugs and alcohol with a 92% success rate.
Wow.
There's really nothing like it. Rehab has about a 20 to 25% success rate, and the average patient will go through a rehab center 7 to 8 times to be able to come off their addiction. So we don't have that issue with NAD.
Wow, that's a pretty compelling compared to our traditional rehab type situations, where you're telling me they have to go through 7 times before they really get any
Right.
benefit from it.
Right. And we've approached several of the inpatient rehab centers here to see, hey, do you want to start adding this? You would be so much more successful. And they didn't have any interest, which is unfortunate because if it really cures the patient, then they count on repeat business, right? So they count on being a revolving door of patients. And so, they count on that failure rate. So they just weren't interested.
Yeah, and now we kind of see that a lot in traditional medicine, and I'm so glad that you stepped out and started looking at regenerative medicine and anti-aging medicine, and we're so good at treating symptoms, but we don't fix the problem. And I think one of the things is why we don't fix the problem is because follow the money. We live in a sick care. Our system is a sick care system, and it likes keeping people sick. I know some people don't like hearing that, but I truly, honestly believe that. What are your thoughts on that, Dr. Ashley?
Oh boy, I couldn't have said it better myself. And it's really sad, and insurance doesn't pay for this, right? So they should. I mean, imagine the money that insurance could actually save by not paying for rehab 7 times. But I beat my head against the door quite a lot with these kind of things. It's the same with bioidentical hormones. It's the same with supplements. Other things to help slow the aging process to really help us to be more vibrant in life. And they don't pay for anything like that. They pay for sickness and pharmaceutical drugs. And you have to understand pharmaceutical drugs finance medical schools, so there's a whole year of we have a whole year of pharmacology. We have 1 hour of nutrition. It's very biased.
Absolutely. I can attest to that being a pharmacist. The biggest donors to pharmacy schools are drug companies. So, and it does just seem that, drug companies are in bed with insurance companies, in bed with, some of the big healthcare entities, like the rehab facilities, like the big hospitals, like the big clinics. I mean, they're all in collusion together. I mean, I really honestly believe that.
Yeah. And it is certainly true. The other thing I've seen with the NAD is that it not only eliminates the cravings, it takes away the withdrawal. So we've had patients coming in who were drinking a gallon of vodka a day. And were even drinking that the day before treatment and came in, shaking. And normally you would never have an alcoholic quit that amount all of a sudden because you could throw them into DTs.
Absolutely.
And to markedly reduce their withdrawal. And so they'll have a little nausea, maybe some muscle crampings, but they just sail through it. And by day 3 is typically the worst. By day 5, they're really starting to improve drastically. And the other thing that the NAD does is it treats anxiety and depression. And every patient with substance abuse of any kind has anxiety, depression, those kind of comorbidities, and it treats that, and they don't feel anxious anymore. They're often able to come off medications for those ailments, and so it treats several different things at once.
So, and a lot of times, probably, I mean, you can comment on this. I'm asking your expert opinion. A lot of times, their addiction might be rooted in that they have depression or anxiety, so they're actually self-medicating to treat those symptoms. Is that correct?
That's correct. Now, we do still recommend mental health counseling because to get to that point where you're using alcohol or meth, a very common combination is alcohol and meth or opiates. How did you get to that point to begin with? And oftentimes these patients don't have the best of lives, or they're going home to a relationship that's not very good or not very supportive. And so there is a lot of mental health counseling that still needs to be dealt with in that regard, but they're able to actually do the work in the mental health field because they're not constantly thinking and desiring their drug.
Right. So you do an IV therapy, and is it daily for 7 days? Is that how that works? Tells me a little bit about the protocol.
Yeah. It's daily for 10 days. Benzos, so that's your Xanax, Ativan, that requires 12 days. But most of them is 10 days, and they're there for anywhere from 6 to 8 hours a day. So it's not just to put the IV in, shoot it in, and you're done. It's a slow drip, and if you turn it up too quickly, they can have vomiting, nausea, vomiting.
Okay.
And then we also give them, while they're here, IV nutrients, because they're always deficient in the B vitamins and amino acids, vitamin C. So magnesium is a big one they're deficient in. So we give that to them IV as well, and then have them take these kind of vitamins throughout the day.
Okay. So there is NAD available over-the-counter supplement oral form, and you're recommending that that's just not high enough dose. You can't get high enough concentrations to really treat addictions like this?
No, in fact, the oral NAD really doesn't work because our stomach acid degrades it so quickly. And we do have NAD as a lozenge that you dissolve under the tongue, and so it's absorbed there. And so I recommend everybody over age 50 be on that, because our production of NAD declines as we age, kind of like everything.
Right.
But no, for if you're wanting to treat a drug addiction, you have to have very high levels of it, and you can't attain it orally.
Okay. So you mentioned you mentioned the alcoholic was drinking a gallon of vodka a day. Can you tell me a little bit about that story? How did that process progress? You put on a 10-day treatment plan, and how did that progress? How did she do?
She did very well, and she had a lot of anxiety and depression as well. She actually worked in the medical field, and so around day 5, that anxiety and depression started to lift, and she was just a new person at the end of it. And we follow up on these patients because I want to know, all right, how are they doing? At week, a month, at 6 months. And she said that for the first time ever, she was able to go to the grocery store and walk through the alcohol section without even looking at it, without any, desiring it at all. And so that was huge.
Yeah, that is so cool. That is really cool. What a great story that is. So you've treated methamphetamine addiction also, is that correct?
Correct. Meth is, unfortunately, is rampant in our society. And we've had patients that, if you look at them, they don't look like the classic meth user, because you see the classic meth user being the one with horrible skin, they're missing their teeth, and they weigh 98 pounds. These were professionals working. They use meth every day. They can't get rid of it, and of course, it's doing that damage to the brain. And so there's nothing that treats meth. There's nothing. You just have to tell them, oh, cold turkey. Well, cold turkey doesn't really work very well. So, but no, it's the same. It's a little bit different protocol. Alcohol has its own protocol. Meth has a little bit different dose, versus the opiates, your painkillers. And, but no, we do very well. In fact, like I said, a lot of people combine meth and alcohol. It's not uncommon for a patient to have various drugs. I don't just drink. Right. I also meth, I also take a few Percocets a day, or you've got to treat all of it. They have all of it. Like, they can't say, yeah, I take 2 Percocets every 3 hours and I drink alcohol. I just want to get off the alcohol. Well, it won't work. You have to get off all of it.
Right. So we know there's it's been in the news a lot lately, or at least over the last few years, maybe not so recently, but opioid addiction is just rampant across the country, and that's not just heroin, but it's legal prescription, OxyContin is the biggest one. So I'm sure you've seen a lot of that in your practice, and can you tell me how NAD has helped some of those patients?
Yeah, heroin use is also more common than you would think, and it usually starts with something like OxyContin. Then it becomes too expensive, so they switch to heroin, which is much cheaper. And heroin and meth use is another common one that they'll use together. But the heroin is the same as it's under that opiate, so it's a kind of protocol, and they'll go through have some withdrawal symptoms around day 2, 3, 4, but minimal compared to if they try to do that on their own. Like, any patient that's addicted to opiates, if they try to just stop on their own, it won't kill them, but they're going to feel like they want to die, right? So,
for sure.
takes that away. And we have different medications to help if they are having a lot of nausea. We treat that and make them more comfortable. But again, it's around day 5 they emerge this different person altogether. So we've been very successful with opiates. We've treated as young as age 14. And then as the top age has been around 75. He's drank his whole life and he just wants to get rid of it. So, and the teenagers, they sometimes get into their parents' drug cabinets and start taking these things, and they can get addicted to them quite quickly.
Yeah, for sure. That's definitely sad. So, what do you see with these people's pain levels after you get them off the opioids and treat them with NAD? How is their pain levels? Do they still have pain, or was that more of a they were just medicating themselves for the addiction?
It's more medication for the addiction. It might start off with pain, which was treated, say, a back injury or a surgery. It was treated with opiates, but then they continued with the opiates, and now they're just treating that. They're treating their addiction. Though it does help chronic pain as well, so it does help to minimize pain. Now, I do think it's useful with the DEA, as you know, has put in some pretty tough restrictions on doctors prescribing opiates, and that really was needed because we were over prescribing, and that led, because we were told, oh, it's not addictive if you treat it appropriately. Yep. Take it every day. Well, that was a lie perpetuated by the drug companies. So, yep. So we've created a lot of these problems.
I agree. I graduated from pharmacy school back in 1994 from the University of Washington, and I remember back then, maybe you can attest to this, they used to teach us all the time how pain was undertreated, especially in the elderly. So the next thing they taught us was that, hey, as long as they're in pain, they won't get addicted. So, just keep it, prescribing more. And then, here we are 25 years later. I think it just, you see the pendulum really swung, and, I think we went too far, just like you said.
Right. And then, so when the doctors say, oh, sorry, I can't give you any more pain pills. And, what's the patient do? They go to a methadone clinic, which is not comfortable. I have a patient, she was made an addict by her physician and prescribed OxyContin. He was in huge doses of this stuff, along with Percocet and so forth. Anyway, so he cut her off, said, you got to go to methadone clinic. I got to get you out. The DEA is coming down my back. I got to get you off this stuff. So she goes to the methadone clinic, and she has to go there every day for her drug. And then as soon as she gets her methadone, there are people there saying, I'll buy your methadone from you. Will you sell me your methadone? So she's surrounded by this environment that she doesn't like, but she can't get off the methadone. And so we've been able to help her as well. Methadone actually takes longer than 10 days. It typically takes about 12 to 14 days because of its very long half-life.
Right.
But yeah, so you've got those kind of issues. I also prescribe, Suboxone for patients that want it. But it's better than using opiates, but it's not. To me, it's not a good answer because now you're on another drug for the rest of your life.
Right. I mean, the whole theory is that we should be able to get them off their drug, and they don't need that drug. Right. They should just be able to keep their body healthy by the way they eat, by the way they exercise, by the way they sleep after you get them cleared of that drug therapy, for sure, in my opinion. And when you think about what a methadone clinic does, I mean, you just said that just now, and I just realized, I mean, so they've just traded, an OxyContin addiction for a methadone addiction. I mean, really, that's what we've done. Is that correct in those methadone clinics?
Yeah, and methadone's a horrible drug, horrible. I mean, it kills a lot of people because it's, being a pharmacist, the way it's metabolized and the way it built them. And so that was not, to me, it was not a good answer at all.
Yeah, no. Well, go ahead.
And this NAD is so successful. I just wish I could really get the word out there. And I wish I could get insurance to pay for it. We could help, because it's not cheap. I mean, it's an expensive product to us.
Yep.
Specialized pharmacy that compounded. And so a typical 10-day treatment costs about $8,000. But it's cheaper than rehab by thousands and thousands.
Well, and not only that, I mean, rehab, I think it's cheaper. Rehab's probably like $30,000, I'm guessing. I'm sure it depends and it varies widely. But again, look at the consequences if they and their lost opportunity cost if they stay addicted to those drugs. I mean, $8,000 is pennies really when you think about it, because it's pretty easy to eat up in drug addiction. $8,000, even if it's not in the drug cost, in a lot of other indirect costs, it sure is easy to eat up that kind of money.
Right. Well, and I've had patients where they're spending $4,000 or $5,000 a month on their drug of choice. So
Wow.
yeah, 8,000 is nothing. It really saves in the long run. Plus, it repairs it gives their it can help establish their relationships back, get their families back.
Right. It essentially gives them their health back.
Right.
Yeah.
Right.
So tell me about NAD and its uses in other diseases like Alzheimer's and Parkinson's.
Right. So we use it in neurodegenerative disease. So that would be Parkinson's, traumatic brain injury, dementia of any kind. And for the same reason, crosses the blood-brain barrier, helps to repair areas in the brain. For these kind of things, we use it for 5 days. But we have used it, for example, we had a patient with dementia that was severe enough to be in a nursing home, and she wasn't communicative. She didn't really recognize her daughter. The daughter said, I want to try just one last thing. So we did 5 days of the NAD, and we followed by stem cells IV. And she said in 3 weeks, her mom woke up. She was smiling. She could recognize the daughter. She was still living at the nursing home, but her whole personality changed. It was like waking up again. She was able to go out to eat with her daughter, enjoy lunch, those kind of things, which she couldn't do before. And then we've used it for Parkinson's as well. It helps their balance tremendously, and it helps it's not a cure. None of these things are a cure, but it does help to slow the progression, repair some of the damage. So ideally, you'd want, if a patient wanted to be really aggressive about it, you would repeat the treatment every 3 to 6 months, just to help slow it down.
Oh, okay. Yeah, that makes sense, because it is a progressive disease, and that's one of the things about most forms of dementia and Parkinson's is we haven't really found any way to stop the progression. We found drugs that can treat some of the symptoms, but stopping the progression is pretty difficult. We haven't found a way yet that I know of.
No, it's a horrible disease. Dementia, Alzheimer's, it just robs your very being.
So speaking of that, then I guess really the thought is you have to prevent those diseases, correct?
Correct. Yeah.
So tell us, being a regenerative medicine and anti-aging specialist, tell us how we can prevent some of those mental type diseases like that.
It comes to the advice your mama probably told you: diet. Okay, eliminate the sugar. Try to reduce the grains, the starch, the processed foods, the bad trans fats. Eliminate those foods. Exercise, because physical exercise is good for the brain as well, and keep your weight down. And then there are a lot of different brain supplements which can be very useful. I mean, just good old fish oil, but make sure it's a good brand of fish oil. Doesn't have any mercury in it, those kind of things. So if a person would just do that, they'd be way ahead of the game.
And what about neurohormones? I mean, I've been studying a lot on progesterone and how it works in the brain and how it's metabolized to allopregnanolone. So can you speak a little bit about hormone replacement and brain activity?
Yes. So the male brain is highly dependent on testosterone, and testosterone, as it declines, causes that brain fog. So in men, we'll frequently give testosterone, DHEA, pregnenolone, like you were saying. And then the female brain is highly dependent on estrogen. So I'll see women going through menopause, and then they think they have Alzheimer's because they can't, they get that brain fog and it's fuzzy. And so we'll give them bioidentical hormones, and then with the DHEA, pregnenolone again, and all that reverses. And there's some good studies showing that these hormones help to reduce the risk of Alzheimer's or other dementias long term.
Yeah, I've seen those. So what you're basically saying is when men or women get into their 40s and 50s and they have this brain fog or possibly some kind of mental issues, maybe depression, they don't really maybe lack Prozac, they might lack hormones, correct?
Correct. Yeah, and especially, I can't tell you how many men we've had come in here and their doctor had told them that they're depressed or they're anxious and they don't have any motivation, and all they have is a low testosterone. You give that back, they don't need Prozac. You give that back, you get it to restore to a more youthful level, and they wake up, and all of that is lifted again.
It's amazing. It's amazing.
Yeah.
Well, one of the things is you talked about you want to get the word out. That's one of the goals of our podcast about the treatments that you're doing, the NAD treatment, the bioidentical hormone treatment. We want to educate and empower consumers with this podcast that people are in charge of their own health. And they need to take charge of their own health. And the only way some of them can do, most anybody can do that is through education. So we have doctors like yourself on. So patients know that there are choices out there. And, so speaking of choices, in our last couple minutes, Dr. Ashley, what would you like to sum up your message today, and how can people get a hold of you?
Well, they can reach me at my clinic, Family Medicine Liberty Lake. And if they just Google me, Liberty Lake, I come right up. But the message is that any kind of substance abuse, you don't have to be a slave to it anymore. There is help for that. And with a 92% success rate, and you can say goodbye to that aspect of your life and get onto your life and become that person that you were really put here for, that you're really meant to be.
That's awesome. I really appreciate it. Well, you have definitely educated me over the last half hour. I really appreciate it. I know you're a busy person and busy with patients, and I appreciate you taking the time out of your busy schedule to meet with us today and educate our listeners and viewers. So thank you very much, Dr. Ashley.
Thank you.
Yeah, you've been listening to Health Solutions with Shawn and Janet Needham, and tomorrow, don't miss out. We will have Spike Owen on. He will be talking about free market healthcare. We talked about a little bit today in the podcast where we talk about how, there's some controlling factors behind our healthcare system now, our traditional healthcare system, and it's not really free market principles. That's why I wrote a book about it. I wrote a book called Sickened, How the Government Ruined Healthcare and How to Fix It. And we will be talking about that tomorrow with Spike Owen. I will also be telling you how Amazon has been trying to censor my book. And why would they want to censor my book? They haven't in over almost a year now. Now all of a sudden come election time, they want to censor my book. Do they not want the truth to come out? Tune in tomorrow because I will talk a little bit more about that with Spike Cohen, Libertarian candidate for vice president. So you've been listening to Health Solutions with Shawn and Janet Needham. Tune in tomorrow, noon to 1 p.m. Pacific Standard Time. Thank you so much for listening.